Now, everybody is complaining about the fact that they don't want socialism in the country. Well, let's take a look at it. All the public services on this list are actually socialized. They're run by the government and they have government employees. And yet, without a profit, they all deliver high quality at a low cost. A single-payer system offers the same benefits by taking the profit motive out of health insurance. But unlike these other public health services, medical providers will not be employees of the government. They will remain private. They will simply not be investor-owned. Single-payer is as American as apple pie. Well, you've probably heard congressional representatives say, with a straight face, that a publicly funded healthcare system will have death panels that decide on when to pull the plug on Granny. Well, what's the reality? Here are the claim denial rates of the 5 top insurance companies in California. Between them, they managed to deny service to 1/3 of their clients. With no care, or with care not delivered on time, many of these people will lose their lives or their jobs or their homes. So, who's got the death panels? You've probably heard stories about Canadians flocking to the U.S. for medical services because their own health system is so bad. Well, here are the facts. Americans go abroad looking for health care more than twice as much per capita as Canadians. So, if this means that the Canadian system has big problems, well, aren't our problems twice as big? If you're not convinced yet, here's what your fellow Americans think. Recent polls have shown that 82% of Americans are dissatisfied with the expense of our current healthcare system, and almost 60% are very dissatisfied. But even though they don't like the costs, people still feel that having close to 50 million people uninsured is much more serious than just the high cost. People even think that full access to health coverage is more important than tax cuts, and everybody knows how we Americans love our tax cuts. And how well do most people really understand the issues? Well, despite the massive power and influence of the for-profit industry in opposing healthcare reform, polls show that Abraham Lincoln was right when he said that you can't fool all the people all the time. Sooner or later, we will adopt a single-payer system. So why not do it sooner before we all go broke from the medical bills? But the news is out. Everybody's saying it's impossible to get Congress to pass single-payer. Well, if that's the case, shouldn't we support a bill that at least includes an optional public plan to compete with the private insurers and bring their prices down, covering everyone who's not covered now? Well, maybe that would be at least a step in the right direction. Well, the main bill being considered in the House now, the so-called public option bill, is neither public nor an option for most Americans. We really need to examine carefully the so-called public option because the insurance industry has managed to write intentionally hidden problems into the healthcare bill now being considered. They're hidden because you'll need a whole team of lawyers to understand the legal language, not to mention the redefinition of common phrases that make it even more opaque. But let's start with the obvious. First of all, this bill will add more than $1 trillion to a national budget because it keeps in all the private insurance companies with their inefficiencies and profits. Now for the first hidden problem. If you're covered by an employer-supported or individual private plan, well, when this bill goes into effect, you'll be locked into your existing plan for up to 5 years or more, even if that plan costs more and gives fewer benefits than the new public plan. You won't be allowed to use their exchange. Even employers who might want to change the plans covering their employees won't be permitted to do so. So this effectively destroys any choice for most Americans, while at the same time it cherry-picks the healthiest members, all those people healthy enough to be working, by locking them into their current plans. So the public plan is left with the less healthy and therefore costlier members. To seal its fate, the public plan is forbidden any subsidies to make up for this cherry-picking. The coverage is not comprehensive, and it leaves many things uncovered and others only partially covered. It still leaves millions uninsured, and it won't eliminate out-of-pocket costs. But that's not all. Furthermore, this bill requires a public plan to be funded entirely through tiered premiums. Tiered premiums that pay for tiered benefits. So just like now, only those people who can pay the most get the best coverage. It also allows people's premiums to be doubled as they get older. It forces people to buy insurance and fines them if they don't. So what can we do about this? Well, to begin with, you can insist that legislators fix the public plan that is inside the H.R. 3200 bill before it gets passed. And here's how. The public option needs to be an improved, expanded, traditional Medicare-like plan. It has to be available to every American from the start. It's got to be publicly funded with no premiums and no tiered benefits. And it has to include comprehensive coverage, including prescriptions. What you can do is you could tell your representatives and the President that you like H.R. 676, the Medicare for All bill. Now, even his sponsor admits that it's not going to be considered, let alone passed. So, what you could do is tell them that the Wiener Amendment is the best fix, because that changes the H.R. 3200 bill into 676, which is the universal single-payer system we're talking about here. You can get active yourself and take a copy of this slideshow to present to your friends, family, and coworkers. You can use a lot of different methods to spread the word about single-payer Medicare for All. So what you should start by doing is to call, fax, and email the White House and your legislators and tell them to pass a single-payer bill if at all possible. Call the legislators who are on the committees dealing with healthcare reform. Tell them you're a single-issue voter this time, and that your issue is single-payer for all. Get everybody you know to do the same. So please write down these contact numbers, and use them as often as you can, and have others do it as well. I'll leave these up here for a minute so you can write them down. If you live in Tucson, we invite you to join Single Payer Now. You can contact us by phone or by email. If you're interested, here's a list of sources for the information that I presented in these slides. If you want, you can ask for a copy of this source list. So thank you for listening. I hope you've been inspired to get into action yourself. Once again, I invite you to join us, Single Payer Now in Tucson. Call or email us, and we'll be happy to get you into the system. Thanks again.